Now I'm going to perform bandaging and splinting on a child having a laceration on her right popliteal region with a 1-inch wound and severe bleeding, and um, a closed fracture on her right tibia. So first thing to do is check the area if if it is safe or not. So if the area is not safe, move to a safer location immediately, and if the area is safe, proceed to your care. Then next is check the person visually if the person is conscious or unconscious, and if the person is breathing or not breathing, and if there's any wound or severe bleeding. Next is to decide whether to give care or call first. So in my case, with the severe bleeding present, so I'm going to decide to give care for the person before calling for emergency response. Next is after that, after you decide, you introduce yourself and obtain consent. So ma'am, I'm Junjun Pasquita, a physical therapist, and it seems like you have a wound in your lower extremity of your body, ma'am, and I'm going to give care. So is it alright if there's any physical touch involved?
Yes.
Okay, so next thing to do is interview the patient. So what is your name, ma'am?
Kay Pasquita.
So what happened to your ma'am?
Nasagid sa kahoy.
Ah, okay. So you're feeling any pain right now, ma'am?
Yes.
So, on scale of 1 to 10, ma'am, how painful it is?
7.
Okay. So, after interviewing the patient, so you proceed immediately. Now you check visually the patient from head to toe and check for any shocks. Then, after that, you proceed to your care. So, first thing to do is position, slightly bend the knee of the patient, slightly bend the leg of the patient. So, ma'am, you may. Then after that, because of the severe bleeding, clean the wound first with a clean cloth, and after cleaning, you apply a sterile dressing on the affected area and have the patient apply pressure on that. So, ma'am, can you apply pressure? After that, apply the appropriate bandage. So the appropriate bandage is a bandage with a 7.5 centimeter width. So to apply the bandage, first apply on the affected area first. You go around affected area first. And after that, you go to the upper area of the knee. Then go around to the lower area of the knee. Repeat the process as you increase the area of the bandage. So increasing the area of the bandage help will help for the wound to not get infected easily. After that, secure the bandage. And after applying the bandage, you check the patient's leg if can still feel anything or the circulation is fine. So seems like the circulation is fine. So mom, can you move your toes? And can you feel anything?
Yes, a bit.
Okay. So now I'm going to apply splinting on the right tibia of the patient. So to 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 perform splinting and apply the right splinting the right splints on the on the affected extremity. with appropriate length of the splint. So going to ask you to relax your leg. Apply splints on both area of the affected extremity. Then with the fracture on this area of the extremity of the patient, you apply a cravat the up on the upper part of the affected area. So caution, do not apply a cravat on the surface of the affected area. And then you tie the cravat with a square knot. Then you apply another cravat on the lower part of the affected area of extremity to ensure that the splint is in stable position. Another square knot here. Then after that, if you check the leg if you can still feel anything and for the circulation. So ma'am, move your toes. And can you still feel anything? Then after applying care, you call for emergency response. So in calling emergency response, you include the important information such as location of the emergency and um, number of people that have experienced emergency and what emergency have occurred in your location. So that's